I'm a professor of psychiatry at Indiana University. I'm a chairman and medical director of a psychiatry service in the South Bend, Indiana area. You know, the history of bipolar disorder is that people suffer from recurring episodes. One study over 13 years showed that people have about 6 episodes per year. Now, since Tanaz has been doing laughter yoga, she went more than 10 years without any symptoms. 10 years without any symptoms when the normal course would have been 6 episodes per year. Now, not all episodes would require medication changes in our studies, but at least 6 episodes per year. So that tells you something about what laughter yoga has done for Tanaz. And so that made me interested in looking at what causes that, what helped with that. So there are good studies showing that laughter triggers several hormones in the brain, especially in the areas which we know are associated with feeling good, in the amygdala, in the nucleus accumbens in the brain. So the hormones that have been studied have been increase in dopamine, which is the pleasure hormone, serotonin, which is the mood hormone, the feeling good kind of hormones, endorphins, the pleasure hormones, a drop in cortisol, which is the stress hormone, a drop in adrenaline, which is also tension hormone. There is an increase in oxytocin, the hormone of connection with people. That's what mothers experience with their babies when they are first born and creates the bonding. That's what encourages bonding among people. Now, in addition to that, one new area of study in mental health are what we call cytokines. You might have heard about them also in the COVID days because we talk about a cytokine storm that causes the severity of the illness. Now, there were studies done actually looking at the effect of laughter on cytokines. Some cytokines are pro-inflammatory, they increase inflammation. Some are anti-inflammatory, they reduce inflammation. And there are studies done with groups of patients with systemic lupus, with patients with rheumatoid arthritis, with patients with diabetes, showing that when you laugh, you are able to reduce the pro-inflammation cytokines, like what we call TNF-alpha, interleukin-6. These are the bad cytokines. And in reverse, you increase interleukin-2, which is the anti-inflammation marker. To jump back into psychiatry, now we're studying a lot of cytokines in psychiatry and knowing that inflammation in the body travels to the brain and can generate those kind of symptoms of mania or depression or anxiety or panic attacks or schizophrenia. So we know that now laughter, we can see how laughter yoga makes a big difference. I wish there'd be one way to study this in a larger population so that we can prove it as the data encapsulated. If you summarize all what has been shown in different studies, it is obvious to conclude that laughter yoga makes a difference in how the nucleus accumbens would work, how the prefrontal cortex will work, and how that circuit between them will be modulated. We have something we call neuroplasticity in psychiatry, which is everybody has done that. If you've ever learned a new trick, if you've ever given up a bad habit, you know that you have changed how your brain works. You create a new pathway, a new circle in your brain, a new circuit that overrides the old negative circuits. And that has a lot to do with physical health and mental health. So laughter yoga, I think by doing it repeatedly, as Tanaz is saying, you enforce this new pathway in your brain. And it will be a new circuit that will override all the other bad circuits that you've had before. The more you practice it, the more that circuit works. And you've seen it, I've seen it with Tanaz, as I said earlier, when one would have expected 6 episodes per year, none for more than 10 years, 0. I would say the medications have a role to play, certainly, and please don't overlook that. But lifestyle, laughter yoga is tremendously important.